Dr. Rob Silverman here, Facebook Live. Wanted to come on a little earlier today. We had a nice break in the office today. A couple of my patients had asked me, as you guys all know, I treat a lot of concussion and a lot on the gut to brain axis. So I make a lot of ketogenic recommendations. So some people really wanted to know about the ketogenic diet and the ketogenic diet for concussion. So I want to cover some ketogenic protocols for concussion. So before we go any further, the ketogenic diet has sort of taken the world by storm, but it's really not a new diet. It was used in the 30s for epilepsy in children. It got real popular in the last 3, 4, 5 years. So let's go over the ketogenic diet. 75% fat, 20% protein, and about 5% carbohydrates. The premise of the ketogenic diet is to switch from the use of carbohydrates as your main source of fuel and use what we call ketone bodies. Beta-hydroxybutyrate is what I like to refer to as the gold medal winner. And that's the one that we're really going to emphasize in the conversation. Ketogenic diet has also been shown to really help as a substrate for brain fuel. So I'm a proponent of the ketogenic diet, but I do want to have one caveat. I believe in individualizing diets for people's genetic dispositions and where they are in life and what their goals are. So I just don't say ketogenic diet for everybody who walks in, Mediterranean diet for everybody who walks in, paleo diet for everybody who walks in. I'm specifically talking about applying ketogenic and ketogenic protocols for people that have an initial concussion and one that suffer from what we call post-concussive symptoms or post-concussive syndrome. Now that we said that, let's get into the idea of what happens after concussion. A certain amount of people who have a concussion and or a TBI, traumatic brain injury, and they're not the same, can have seizures. So as I said earlier, those people in the 30s, the children who had seizures, used the ketogenic diet with great outcome. It makes a lot of sense, the ketogenic diet. I have some notes here. It's very sustainable. The concept of the ketogenic diet is really, for me, you don't necessarily just have to be in ketosis, but on a protocol that's pointed at concussions, you want to have a low carbohydrate intake because carbohydrates are not a good source of fuel for the brain. They're a poor source of fuel. The fat is a much better source. So even if you can't get into ketosis or find your means to getting a ketogenic diet, low carbohydrate diet with exogenous ketones would be a great choice. And I'm going to go through the different types of exogenous ketones that you can use. You'll find it very efficacious, again, if you've got this issue with your brain, and very efficacious in general for athletic performance. As an aside, not to go off the rails, ketogenic diet and ketone bodies are excellent for endurance athletes, and they've also shown to have positive effects on power athletes. So the ketogenic diet is a consideration for many people, whether you use it in a short period of time or you do it on a little bit long period of time. Now, some people have complained on a long period of time that it's changed like triglyceride levels, it's damaged cholesterol levels and elevated them. The literature does not bear that out. So then, remember, blood tests are snapshots in times. If you're looking over a 3 to 6 month period, and I can give you and substantiate the claim, they don't necessarily raise those deleterious markers. So let's talk about the supplemental. One of the best ways to test your ketone body level is something called the glucose ketone index. It's sort of new to me, just starting to implement it in the office, and it's your blood glucose level over your blood ketone level. You'll get usually a number of 1. The optimum, when I say 1, really a single digit. The optimum level of that blood glucose index is 1 to 2. What it's shown in that range is that it lowers inflammation and it provides a great alternative energy source to the brain. Now, interesting, salts are more efficacious than esters. So salts, ketone salts, NaCl with exogenous ketones, beta-hydroxybutyrate, versus the powder. So the salt is really good, and many people have used what we call the ketone salts because people who are trying to get into ketosis sometimes suffer from what we call the keto flu. The keto flu comes on day 3 when your central nervous system is searching for energy and no longer is really able to burn carbohydrates efficiently and wants to flick that switch to fat. The salts help you because it puts you right into ketosis and it gives you this exogenous ketone bodies. But what it also does, or additionally, it adds the salt. Because what happens is when you cut carbohydrates and you go to fat, you're actually losing a lot of water. Carbs make you retain water. So there's what we call a swoosh. And when you have this swoosh and flush out all those electrolytes, you're losing those electrolytes. So when you take in the NaCl salt, you're now putting the electrolytes back in, and you're not going to have that keto flu. Just want to let you know that those people who've had the keto flu, they are not happy campers. So I definitely tell them to avoid the flu, and you can avoid it by using the NaCl. So we've got, how does MCT oil come into play here? I am getting to that. You're going to love that. The source, the best approach, is actually the ketone salt and the MCT oil. So medium chain triglyceride oil, which typically comes from coconut, it's an extrapolation of coconut oil, and in that it should be carbon 8 and carbon 10, because carbon 8 and carbon 10 are true medium chain triglycerides. Many, or about 30%, actually about 70% of coconut oil is what we call lauric acid. That's carbon 12. The problem with lauric acid is that it actually should be renamed long chain fatty acid, so it's not a great energy source. Lauric acid is great antimicrobial, antibacterial. So MCT oil is a great choice. So MCT oil with the salt is excellent because that combination really gets those people who are in acute concussion into ketosis. Exogenous ketone bodies provide immediate substrate. So again, exogenous is something you're taking from the outside. Endogenous is something that you produce through diet. Obviously, exogenous, coming from the outside, you can take much quicker because it takes a little while to start using fat as a fuel. MCT molecule is stimulating ketones to be made in the liver. So let me extrapolate on that. So when you take the MCT oil, to speak to what May said, it's a great choice for fuel, but it goes straight to the liver, not the gut. So it's a very quick pathway, and the liver produces ketone bodies. However, when you take the actual beta-hydroxybutyrate in the salt, it goes right to the brain. Now, the MCT oil is interesting in that it also passes what we call the blood-brain barrier. So it's still a great choice for brain energy. So once again, if someone comes in with an acute concussion, ketone salts with MCT oil, that is the sandwich jam, if you will. Now, some other things that'll really make the ketones get in a little quicker and really supply quick brain energy is the use of caffeine with ketones. So I'm a big coffee guy, and we're going to have some coffee things coming out that we're going to talk about, and you guys are really going to love it as a substrate. So caffeine administered with MCT oil leads you to convert more of those MCTs to ketones. So the substrate of caffeine is an outstanding addition mixed with a functional nutrition like an MCT oil because it makes it more bioavailable. What better choice, and what better choice than in an organic coffee? MCT oil becomes more ketogenic when you consume it with caffeine because it stimulates the beta oxidation of fats. Now, MCT oil is fats. Coffee is known to break down fats. The mixture, again, that coffee with the caffeine is a much better substrate to get in the energy in the ketone bodies. Caffeine with ketone results in enhanced brain energy and metabolism. So that's a great point. Now, I've talked a lot about beta-hydroxybutyrate. Now, it comes in a few different forms. And it comes in what we call a D form and an L form. And many of the companies don't describe what they have in MCT oil. So let me give you some caveats. One, MCT oil. I want it from coconut oil. I do not want it from palm oil. Please let me make that clear. We want it from coconut oil and not palm oil. If you're looking for a quick brain energy, the bulk should be C8, about 90%. It's much faster. And the other 10% should be C10. No lauric acid should be in there. So when you look at MCT oil, please look at C8 and C10. My good friends at Nutridyne do a great job. That's the perfect formulation. Then the D form gets metabolized and used in skeletal muscle more efficiently, whereas the L form sticks around in tissues longer and has what we call those beneficial signaling effects. So it kind of works like a drug without the side effects. And some of the byproducts of it, or the positive functions, is that the use of the L form of beta-hydroxybutyrate actually decreases the release of the NLRP3 inflammasome. So if I were to put the slide up, and I'm actually going to give one to Steph, and we'll put it up later, you'll see two signals that stimulate the NLRP3 inflammasome. That's the inflammasome that everybody talks about now with this cytokine storm. The receptor, and toll-like receptor 4, not to get too technical, is blocked by omega-3 fatty acids, and the second one is blocked by ketone bodies, that L-beta hydroxybutyrate. So imagine that combination to decrease inflammation. It also has some positive effects on other anti-inflammatory effects and diets. So the takeaway here, or the nugget, if you will, is you need an equal amount of the L and the D beta hydroxybutyrate if you want to take it exogenously. So I'm a proponent of the ketogenic diet. I implement a lot of ketogenic protocols within my concussion patients, especially if they're acute. I get them right into ketosis, and even if they've had it 6 weeks, 6 months, or 6 years later, the ketogenic diet is a good choice to be considered for any kind of neurodegenerative disease. It's become very popular with Alzheimer's. Ketogenic diet's a great choice if you're in concussion, but the ultimate concept is if you can't get them into ketosis, low carbohydrates, and find exogenous beta hydroxybutyrate. So I know it's a little early. We normally come on a little later. Feel free if you have any questions. Did I miss anything, Steph? Or it's been quiet? It's been quiet this morning. Like this, share this. For me, this information, I was able to make a small compendium and share it with you today. I look forward to a lot of different conversations in the future. We'll be back tomorrow. So it's always my pleasure. Dr. Rob, always yours now.